Can you tell me what role are you going to have when whatever vaccine arrives for COVID?
So I have been tasked to project management and lead the entire vaccine process at Legacy, from procurement, setting up our storage infrastructure, working with a fantastic team to actually stand up our immunization clinics, our infrastructure, even the internal tiering associated with it, and also working with a fantastic communications team too. So I serve as chair and lead for that.
Okay, great. And so can you kind of walk us through the chain of events? Assuming that Pfizer gets an approval today, it's my understanding that the vials will be, driven to a couple of airports and then shipped or flown to places all over the world. So I would assume that it's going to be an airplane coming to Portland.
That is correct. So the timeline is looking like this, where the FDA Advisory Committee for Vaccines is meeting today with, we are all going to be refreshing our browsers constantly over and over again for an announcement. Immediately after that, the CDC's Academy of Immunization Practices is also reviewing the data so that they can give the granularity of which exact patients should be prioritized. Where are there safety signals in which let's go ahead and wait on certain populations so that we can still continue to ensure safety of the community and public. They're also going to give some granularity data of how are there any sort of logistical operations that we as the hospital systems have to consider as we're taking care of our employees and as we're taking care of the community around us. So that group, ACIP as the abbreviation, is going to give their recommendation. In parallel to that, we have the Western Pact, so the Western States Scientific Community, which is a community of vaccine experts that is comprised of Oregon, Washington State, Nevada, and California, are doing a safety evaluation in parallel to ACIP. All that is going to be happening in a very short time course, and my expectation is that we're going to receive the signal of safety from both the Western Pact as well as the ACIP group in days, perhaps even within this weekend. In parallel to that, as soon as the FDA gives the approval, you're correct, Pat, is that Pfizer is going to be drop shipping vaccines out to any of the identified institutions that are designated as that tier 1 group to start to execute the vaccination process. There are some institutions locally, including Legacy, that we've been selected because of our infrastructure to actually have vaccine placed prior to those recommendations coming out officially. So we're going to be storing those vaccines in our ultra frozens, waiting for that green light from both the advisory committees and ultimately the Department of Health.
Okay, so do you already have the vaccine?
We do not. We've gotten a shipment confirmation, so we are watching those shipment tracking, with pretty bated breath and excitement.
Sort of like you've ordered it from Amazon.
Absolutely. I wish it was that one day overnight Prime.
Okay, so and are you able to say, you expect Friday at 1 a.m. An airplane's going to land at the airport and you're going to send a van and some cop cars out to escort it, or any of that kind of stuff?
It sounds like that it's going to be delivered in pretty secure channels directly to our identified institutions that have the ultra frozens in place. So it's probably going to follow a similar just supply chain of moving it over with the logistics of cold chain and ultra cold management associated too.
Okay, and we always try and give our viewers as much info as possible. Are you not comfortable saying when exactly it will arrive and that kind of thing?
I think I'll defer on that, just only because we will have it, but we won't be able to use it until the Department of Health actually gives us the go from a safety perspective. So really all it is staging it ahead of time. I can tell you that it's probably going to arrive sometime during the weekend. Any more granularity, I'm just subject to the delays that we experienced during when we're expecting an Amazon package. So
yeah, all right, and you don't want yeah, and you don't want a porch pilot swiping it either.
Right. Hopefully our security system is a little better than Ring, so hopefully we're a little bit more equipped to handle that.
Okay, and as far as you talked about the granularity on who should get it and who shouldn't, but I'm willing to bet you already have pretty good structure on who will get it, and you're just looking for anything that would change that?
That is absolutely correct. So, from the very beginning, the CDC has been addressing and looking at the populations that should be considered in what's called tier one, given the limited quantities that are available, as you've seen in other news and interviews. And their ask is threefold: is one, who are the patients at highest risk, or who are individuals at highest risk? Who are individuals in which we can rapidly vaccinate so that this benefit of vaccinating those individuals reciprocates out to the community. If we can vaccinate one individual, can that one individual then benefit multitudes by keeping them healthy? And then last is the ethics of it, to ensure that we are taking into consideration equity, which is an immense guiding northern light for us at Legacy, in making sure that we are recognizing how much of an impact this has had in such a disparaging manner to many of the underrepresented individuals in our community. So within Legacy, what we've done is we've actually removed the title of discipline from individuals. We aren't prioritizing a job title over another, and instead we are actually addressing it from which units are most heavily hit by COVID, and we're making our philosophy is that if you care for a patient on a heavy hit unit, you can get a vaccine if you want a vaccine. We're not going to force it on you, but we encourage you to do it. It doesn't matter what your role is there. You are caring for a patient, so we are going to care for you.
Okay, and how many doses are you expecting, and how many people will get it?
Right now, we're expecting on that first drop ship about 2,000 for all of the Oregon Legacy institutions on that first week.
Okay, and will it be? I mean, I think most of us assume it's going to be doctors and nurses kind of on the front lines.
I think that goes back to the previous point, is that of course they are the people in the front of minds of a lot of individuals, but I think again, kind of taking consideration that the hospitals can't operate if we don't have the individuals that are keeping the hygiene between patients within a room. Our environmental services, our patients need to eat, so our dietary and food services have to be prioritized as well. Our lab services, the people that go and admit these patients and counsel these patients, who bring the coffee up, they are just as equal in importance as our physicians and nurses. So it's a very, I just want to say it's a high priority for us to establish equity in our approach to who we vaccinate.
Yeah, okay. But I'm willing to guess out of those groups, and probably the janitors and all the others, there's way more than 2,000. So how are you going to decide who the first 2,000 are?
Yeah, that's an excellent question. Really, we have had to take that into consideration. We don't want to do a first come, first serve, right? Because there are the equities of just an hourly employee versus an exempt employee of being present there. So we are working with our unit and department managers and directors to build a system that encourages an equity forward allocation with that. I can't speak a lot to any more details to that because I'm not the sausage maker in that. I have a good team to address that, but I have a lot of confidence in how much we've emphasized equity.
Okay, but it sounds like basically different units will say, okay, here's our 20 people that we want to have first in line.
I believe so. I think that very loosely we can say that,
Okay.
with the understanding that again that we have emphasized quite a bit is that no individual is more important than another individual, and we are all equally important in the care of our patients.
Okay, cool. And sort of as the vaccine expert, can you take a moment and explain why the Pfizer vaccine has to be so cold?
That's a great question. I mean, I'll say that some of it's going to be a little speculation, and I will refer you over to the experts in the Oregon Health Authority. But I think that it comes down to two things that that we've been talking about. Is one, the nature of mRNA, which is the basis of this vaccine. It itself may require extraordinary storage conditions, just given the fragility of an mRNA strand. It may also be, when you're looking at this vaccine, the lipid nanoparticle. So in order for this mRNA to not get degraded by our body, which doesn't like foreign material, it's encapsulated into a safe lipid lipid nanoparticle, and maybe that particle that requires that degree of ultra cold storage. So those are the two speculations of why why it does need. We are very interested in seeing how did Moderna get around that, and is Pfizer going to be taking a page out of the research of Moderna so that we have more flexibility in how we deploy the vaccine.
Okay, cool. And your folks sent over some video, I think, of you opening one of the doors. Can you tell us what we're seeing there?
Yeah, that is one of our ultra frozens. That's one of our older units, but it's one of those reliable older units that has served us well. And what you're seeing is me just reaching over, opening the door, and as soon as we open it, you can see each of the compartments being held at about a minus 75 degrees Celsius approach. And you see the frost in there, and in order to handle that are special gloves that we have to use, which you saw me don and open the door to give you a little tour of that.
Okay. And I barely got through chemistry in high school, much less anything else. Going back to the super cold and the effect that it has on the vaccine, I'm thinking that I'm hearing you say partly that by being so cold, it makes the structure a little bit more solid at that nano level?
That's our thought. Given the nature of how this vaccine is made and what this vaccine is, it seems like that it does just require much colder temperatures to maintain a good shelf life, essentially. So imagine it as a special bottle of milk that requires a pretty high degree of care and refrigeration. Once you take that bottle of milk out and you let it sit on your counter for a few days, it's probably something that you don't want to start drinking afterwards. So you've got a shelf life of about a day with that bottle of milk versus if you keep it in the refrigerator, you've probably got your 2 weeks associated with that. So imagine this as being a very special bottle of milk that has extraordinary shelf life requirements.
Okay, cool. And I assume you've got storage for 2,000. I'm wondering how much more could you hold? I guess that's my question.
That's a good question. We probably have, if I were to just throw a number out there, we probably have the capacity across all of our ultra frozens for hundreds of thousands of doses, very likely, if I were to calculate it. Because one thing to kind of consider is that each of the vials hold multiple doses. The Pfizer vials have 5 doses per vial, whereas when the Moderna product is approved, and there are 10 doses in those vials. So
that's interesting.
We get a lot of bang for our buck from each of the vials.
Yeah, absolutely. Okay. All right. And speaking of granularity, that makes me wonder, how do the people who are giving the shot know that they're just getting 1 dose out of the vial?
We have a pretty good accounting system with it. So the mechanics of the pharmacy package inserts associated with that measure it to the very volume. So we know per volume, 1 milliliter, for example, will be 1 dose, and that's just an example where I haven't looked at the package insert to that degree yet, but we'll know per drawn volume.
Okay, cool. I just think that's kind of fascinating.
Yeah.
And then, do you, back to the big picture stuff, do you have any sense for whether folks at Legacy are eager to get this, or whether it's hard to find those first 2,000?
I think those 2,000 doses are going to go quick. We've been communicating to our employees and to our volunteers and to our partnered relationships that this is the sign of hope that we've been waiting for the past 9.5 to 10 months. Hope is here. It's coming. We just have to hold on. We know the numbers are frighteningly low, but it's just a matter of time. That those allocations, those numbers are going to increase exponentially week over week over week, and we look forward to the time in which we're able to vaccinate those that want it within our institutions, and then open up the doors to be able to vaccinate the communities around us.
Interesting. Okay. And then, so assuming that it comes in over the weekend and that the government has its act together and they've given all the approval, and the parallel Western states folks, there's like green light as well. Would you start vaccinating people, Sunday afternoon at Legacy?
We are going to give ourselves a couple days to read the documents and read to the very syllable and sentence of all the final recommendations, just to make sure that all the operations that we have been standing up will be aligned and we won't be caught flat-footed with one small 1-degree pivot that the regulatory bodies have stated. So probably days, not weeks, but few days after.
Okay, like Wednesday?
Wednesday through Tuesday, something like that.
All right. Just, trying to give people expectations, because I think
Yeah.
it is fascinating. And okay, so what about this? If somebody on the front line gets that shot on Wednesday, how long until, well, number one, does that make them immune to the virus? And number two, how long till their body is making enough antibodies to help?
What a great question. That's excellent. So what we've seen from the studies from shot one, and the vaccines do require 2 doses, right, for full immunity. They haven't been able to show in the papers and the science that there's really much immunity after that first dose. It requires the 2 doses to actually be protected from the virus. So it is something to very much exclaim from the tallest mountain, and with you, Pat, to your viewers, that it is going to be incredibly important to follow up on time with that second dose. What we don't know is how much of a wiggle room there is from the official recommendations. Pfizer is recommending from the science 3 weeks, 3-week window between dose 1 and dose 2. We're waiting with anticipation from the ACIP recommendations of, is there a window of buffer, all right, to do so? But we're setting up scheduling systems within Legacy to, for now, adhere to a very tight window, and we'll be able to liberalize as the recommendations do come out.
Okay, sounds good. And then just as far as the literal shot being given, that will happen somewhere within a Legacy hospital or medical center, I would assume?
That's correct.
Okay, and then as you get maybe more and more and more, you could start branching out to other places possibly.
Absolutely. I think that one of the things that Legacy has excelled at, that I had no part in creating it, but I'm proud of being watching it and experiencing it, are the drive-through vaccination clinics that have been set up, the community clinics that have been set up in partnership with a lot of the other coalitions that exist. So I have very high confidence in that team and being able to stand up as soon as we are given the vials and more vials, we can stand up our infrastructure to take care of our community.
Okay, great. This has been great information. My final questions then are more kind of a personal nature, if you don't mind, but what is this like for you, kind of at the pinnacle of your profession for this health system, to be in charge of this?
It's been humbling. It's been great to see just how many fantastic people there are that will stand up when the call is made, that when we can tell them that hope is coming, we just need help, and we need people to stand up to help us. The amount of hands that are raised to stand up to this, to realize that 10 months meant something. That's been one of the greatest joys of it. I mean, and being able to be that lightning rod for those individuals to ensure that they execute efficiently has been my role, is to make sure that the team members that support this work can do the work in an effective manner, and I can remove barriers for them, has been really my role for that. So I'm incredibly proud of every single individual that has raised their hand, and I continue to applaud the entire group and the community too.
I imagine you've got to feel some pressure to make sure you get it right.
Yes, of course. I think that, and I'll highlight that, Pat, is that I think the reason why we are taking this a little slower than the urgency of perhaps a peer pressure, why we're going to delay, even when the Department of Health says go, we're going to spend a few days reviewing the material, is just the amount of eyes that are watching, and the emotions that have been charged over these 10 months, is that we have to do everything we can to measure 4 times before we make that first cut. We want that first cut to be even, vertical to the ground, and beautiful.
I like it. And then finally, for the communities that are still hesitant, I was reading a national story today that something like 47% of the Black community not sure. what would you say to them?
I'll say this. I'm never going to disregard your anxiety. I think that your fear is is valid because of the history that you've gone through. I can't imagine, and I'm not going to pretend to imagine what has driven your thoughts to this point. What I can tell you is that I will never make anyone take this vaccine. What I can be is that listening ear, and I can also explain the science to you of what we've done as a science community to ensure safety. We know that this is new technology. We know relative to the other vaccines, it's a 10-year-old technology that's being deployed for the first time. But we know that what it's going to take is for you to trust us. And we hope that as we continue to work with you and work with the community, as we engage people like you, Pat, to be able to give a voice to the community and hopefully be able to make this more of a dialogue than a monologue, that we are able to build that trust and to walk with you to get that vaccine, knowing that there's some anxiety with it.
Okay, terrific. Well said, sir. Anything else you guys want to get out? That was very thorough.
I think that I'll just end it with just this statement of hope is coming. We're going to get out of this. It's just a matter of time, but it will come. We need to be patient in December. I think that everybody's seeing the news and seeing these press releases. Impatience can come, and what we do ask is that be patient. We'll get to you. We will absolutely get to you as fast as we can, but in the most safe manner as possible. Hope is here.